Welcome to Renus Care Radio, covering topics of interest to the nephrology community. In today's episode, we focus on the role of SGLT2 inhibitors in modern medical practice. Sodium glucose cotransporter 2, SGLT2, inhibitors are a relatively new class of medications primarily used in the treatment of type 2 diabetes mellitus, T2DM. By influencing the renal handling of glucose, these drugs offer significant benefits not only for glycemic control but also for cardiovascular and renal protection. This episode discusses the mechanism of action of SGLT2 inhibitors, their clinical benefits, potential side effects, and their evolving role in the management of various chronic conditions. SGLT2 inhibitors operate by targeting the sodium glucose cotransporter 2, a protein responsible for approximately 90% of the glucose reabsorption in the kidney. Located in the proximal renal tubules, this transporter plays a crucial role in the renal absorption of glucose from the filtrate back into the bloodstream. By inhibiting this transporter, SGLT2 inhibitors reduce the reabsorption of glucose, leading to increased excretion of glucose through the urine, thus lowering blood glucose levels. The primary indication for SGLT2 inhibitors is the management of blood glucose levels in patients with T2DM. By promoting glucosuria, these drugs help in reducing hyperglycemia effectively without relying on insulin secretion, making them suitable for use in various stages of diabetes. Beyond glycemic control, SGLT2 inhibitors have shown remarkable benefits in improving cardiovascular outcomes. Clinical trials such as the EMPA-REG outcome trial have demonstrated that these drugs can significantly reduce the risk of cardiovascular death, non-fatal myocardial infarction, and stroke in patients with T2 German marks at high risk of cardiovascular events. Another significant advantage of SGLT2 inhibitors is their nephroprotective effects. They are beneficial in slowing the progression of diabetic nephropathy by reducing intraglomerular pressure and improving tubuloglomerular feedback, which leads to decreased kidney stress. While SGLT2 inhibitors offer substantial benefits, they are also associated with specific side effects. The most common are genitourinary infections due to the increased glucose concentration in the urinary tract, which can promote bacterial and fungal growth. Rare but serious side effects include diabetic ketoacidosis, even in the presence of normal or slightly elevated blood glucose levels, and increased risk of lower limb amputations. These risks necessitate careful patient selection and monitoring. The efficacy of SGLT2 inhibitors in reducing hospitalization for heart failure and protecting kidney function has led to their expanded use beyond diabetes to treat heart failure with reduced ejection fraction, HFrEF, regardless of the presence of diabetes. Ongoing research is exploring the potential benefits of these drugs in other areas of metabolic, cardiovascular, and renal diseases. SGLT2 inhibitors represent a significant advancement in the management of T2DM, with added benefits for cardiovascular and renal health. Their unique mechanism of action offers an effective tool for controlling blood glucose levels while providing substantial cardiorenal protection. As research continues to reveal further benefits and applications of these drugs, SGLT2 inhibitors are likely to become integral in managing a broader range of chronic conditions. Thank you again for joining us here on Renus Care Radio.